Good morning. It is Monday, September 26th. Thank you so much for joining us here on the Morning Medical Update. Man buns lead to hair loss. Men can't get breast cancer. Tight pants and hot tubs affect your fertility. But are these statements really true? We get to the facts and debunk the myths when it comes to men's health. And finding a better prescription for health. A new study compares the health of American men to men around the world. And fresh off the weekend, Dr. Hawkinson joins us with the latest COVID-19 headlines and the COVID count. Thanks so much for joining us here on Facebook, YouTube, and on Twitter this morning. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. From the ultra-serious to the not-so-serious questions, we're debunking some of the most popular men's health myths. It will open your eyes or possibly prompt you to pick up the phone and call your doctor. Joining us today is one of our favorite guests, Vice Chair of Urology, Dr. Ajay Nangia, and his new partner, men's health specialist, Dr. Jake Fantis. Good morning to both of you.
Morning.
Good to see you, and welcome to the health system. New physician here from Chicago, right?
Yes, ma'am.
You liking the area?
I'm loving it so far.
Okay, well, glad to have you. We're putting you in the hot seat today, okay? You're going to debunk some myths for us. Again, we are men's health myth busting today, so no question off limits. Get them sent into us. We have links there right on your screen, or you can leave us a question in the chat thread below. Okay, let's just jump right into it, guys. Dr. Nangia, we're gonna jump right into the hot tub.
Let's just jump into it.
Jump into the hot tub with you this morning. Can you extended time in the hot tub? We hear this a lot. You shouldn't do that because it could affect your fertility. Is that really true? Slightly true? What is it?
It is true.
Okay.
And let me put it into perspective. So it's almost too early to have this conversation.
I know
but
it is.
The scrotum is a radiator, and it's designed to get rid of heat. So whenever you boil your eggs, so to speak, they get too hot, and like the yolk or the white of an egg, which is liquid first and then becomes denatured, and the sperm don't like it. And so they don't like it when there's that temperature above, really 2 degrees below core temperature, so 98.6 or 37 degrees, 2 degrees Fahrenheit lower. And so anything above that core temperature, so to speak, especially fevers, hot tubs, which can be as high as 104, they're bad. The question really is how long? That's the myth. And that has really not been completely proven. There was an article in the Brazilian Journal of Urology, which, I've actually wanted to do a much more thorough study and, of course, have a hot tub on hand every minute of the day. But, the data on how long is questionable.
But men they don't need to avoid it. They just need to maybe think about it, be mindful about how long they're putting the hard-boiled eggs in.
Really, I tell men, if they're trying to have a kid, don't sit in a hot tub. So guys, basically, I'm sorry, if you've just bought one and trying to have a kid, just going to have to leave it alone for a while. It's just not worth the risk of it actually hopefully temporarily affecting their numbers. And I say this, and Dana's here, fever, especially nowadays with COVID, that has been shown to decrease sperm counts.
Dr. Hawkinson, you didn't know you were going to be brought into this conversation early in the show, did you?
I always bring him in the conversation.
You got to.
Well, we've actually had conversations about this since the pandemic began as well, because we know you can isolate the virus and semen and other viruses too. I mean, it's pretty well known. So I think his points are straight on, and certainly. We know that the high temperatures can induce that issue with sperm counts, and not much more to say. He's certainly correct, and we see that we see that quite some time.
But the other thing is, what's very interesting, is COVID actually can cause testicular pain. It's kind of like what mumps can do, and so if there is a reason to be vaccinated, guys, this is it. All right, I would tell you don't want that pain, and I think you all know what I mean.
Okay, so this is a question as old as time. Boxers or briefs?
So that actually is a really, really interesting question, which, again, from a Mythbuster standpoint, the answer is no different. When you talk about that with just your regular underwear, the boxers and briefs that most guys have, the answer is it's no different. But there's a little truth to it, which is if you have super tight underwear, there can be an effect. And what I mean by that, there's actually an interesting study looking at a specific type of underwear that has been created in a French group of researchers that deliberately pushes the testicles up and has been shown to decrease sperm counts pretty much to a level that can act as a contraceptive. Now, how long you wear it, which is all the time, or how much does that feel uncomfortable when you hitch the, boys up there, that's a problem. And, so it's still in the research stages. By the way, there's one other myth buster I wanted to tell you about.
I knew you were going to get one in on me that you didn't tell me about before the show.
I didn't,
what is it?
But it's in this line. So sumo wrestlers. So all of us who have watched sumo wrestling in movies or obviously in real time or whatever, have wondered about the mawashi, if I've said it right, is their uniform, their thong, the man thong that they're wearing, right?
I wonder about that all the time. Thank
you
you for
I'm
pointing that
glad
out.
you wondered, because I've been wondering a lot about it.
Yes.
And so that mawashi has been, the urban legend has been that they hitch the testicles up from an early age to teach them to not get racked down there. Oh. Well, from everything I can tell, now you have to admit some of it is from Google, there's no good scientific study, but I think from anyone who's actually worked with sumo wrestlers, the answer is they don't do that.
So has there been any study on the sumo wrestler population increase or decrease due to the man thong?
Well, you know what? No. And I see what Jake and I are going to do is do that study. We need anyone who wants to give us a research trip to Japan and to talk to sumo wrestlers. We would be up for that.
I think that is money well spent.
Yes.
And this is why you've brought the best of the best, in from
of the
Chicago,
best,
of course.
I have.
Let's bring you in, Dr. Fantas. I want to ask you about a couple of things. Let's talk about just men's health overall and its effect on reproductive in general. To say that men's health doesn't have anything to do with the reproductive health, that seems unreal. Help us debunk that.
Yeah, I mean, that's a great question. And truthfully, men's health affects reproduction in many different ways, going from testosterone levels to erections to ejaculatory function to even sperm functionality. So men's health from a blood pressure perspective, diabetes perspective, even having higher levels of estrogen secondary to being overweight can affect reproduction in many different ways. And again, I think it's really important because Dr. Nagy and I see a lot of these patients that come in with problems with, erections or problems with inability to ejaculate. And then obviously you have 15% of the population struggling with fertility. So I don't think men's health could be any less important in terms of overall procreative potentials.
Okay, so let's move to the prostate and talk about supplements. Nutritional supplements risk or shrink or improve prostate problems. Tell us about that myth.
So there are plenty of really good pharmaceuticals that do help shrink the prostate that are FDA approved for that indication. But I think the nutraceutical industry in general is a little bit dangerous, and it's a slippery slope just because a lot of these things don't have approval. One of my mentors actually wrote a paper in the early 2000s looking at things like saw palmetto at improving men's urinary function. And they actually found a benefit. So there are some studies that show that these supplements really do help. The problem is, subsequent to that study, many well-designed randomized controlled trial have found that there was no benefit using the same drug. And there have even been several meta-analyses, probably the most famous in JAMA in 2011, showing that even at very high doses of some of these supplements, that they don't actually help with a lot of urinary symptoms. Truth be told, most of these things are not dangerous, but because there's no way to have quality control of the ingredients in these, in general, we have men stay away from these.
So how do men get enlarged prostate?
So, the actual etiology of this is somewhat unknown. We do think that testosterone and dihydrotestosterone, which is a specific type of testosterone that's converted and grows the prostate, tends to have these glands that basically impair the urethra, the structure that is between the bladder and the tip of the penis. We know that there's growth that happens over a year, and it accumulates kind of like any part of your body, that there's growth in this area, and it slowly can pinch off the urine stream. Now, it's really important to remember that urinary symptoms may or may not be due to the prostate. There are plenty of men that have normal-sized prostates that have urinary symptoms coming from their bladder, from their diet, from other things that they do, whereas there's other men that have truly enlarged prostates that do cause urinary symptoms.
So if you have a urinary problem that comes on and it's lasting a while, is that a good time to come see you?
Yes, I mean, that's exactly what a urologist does. I mean, it wouldn't be unusual, of course, for patients to go see their primary care doctor first, certainly.
I want to know this. My grandfather died of prostate cancer. If a man lives long enough, he will develop prostate cancer. True or false?
True.
True.
So the going data, it's old, that 70% of 80-year-olds, men, will have prostate cancer. Now, as we say in our business, it's will they die from it or with it? And this was an autopsy study. So they didn't die of prostate cancer, they died for other reasons. And so we're trying to catch, which is very difficult, but that's what all of the emphasis on prostate cancer has been, on early detection, appropriate detection, hopefully predicting who is at high risk of developing the disease and be affected by it, and maybe even death.
Dr. Van Dissen, I want to ask both of you, but I know these conversations can sometimes be, we joke about them being kind of uncomfortable, and when we tease men about not getting the help they need or maybe getting the screenings that they need. I think women can be just as guilty of that as well. But what are you seeing just over time? Are men more into their health and kind of taking control of that? Tell us what you're seeing in your practices and what we can learn from that.
You know, I think it's kind of a mixed bag. Traditionally, it looked like in the early 2000s and mid 2010s that men were making more of a effort to get in to see both primaries and urologists. But there's been a big phenomenon that's really counteracted that, and all these direct-to-consumer marketing of things like Viagra, the Hims and Rows out there, marketing erectile treatment, testosterone treatment, male pattern baldness treatment, kind of took away the men's willingness to necessarily see the physician. And at least from our perspective, it's really important that people come in and be evaluated, have a physical exam, and then, as we talked about, the overall health is important, and making sure people are screened for things. Again, I hate to beat a dead horse, but high blood pressure, high blood sugar, things that you didn't otherwise know you had, that maybe you came in with problems with erections, but there was a reason that you're having those problems.
Exactly. It's not taking the magic pill across the board.
No, but the thing is, and we've talked about this, Jess, I think before, is, young ladies, young girls get seen sooner. They have to have their pap smear. They're taught about breast exams. I know you had a question about breast cancer. They're taught from a young age that they're going to be needing to go to see doctors. We as guys bury our heads in the sand once our mother stops taking us. Right?
You wait till something's wrong.
Then you brake. You're right, like a car. It's like you run it. Like I said this last time, I think when Jill was here, that men are more willing to look after their cars than themselves.
Right. They're not getting the oil
They get
change.
their oil change done, but they're not going to get their own oil change checked. Right? They just drive it till it's in the ground, and then it's broken, and then it can be really broken.
Well, and men are living longer. Do you think this plays into that? Like you said, there's things that you see these commercials out there, and they're taking pills for this and pills for that, and more cosmetically making sure things are running on the outside, but making sure that they're getting to those screenings because they're living longer. True.
Yeah.
True. That plays
into
into
but the
it.
taboo is about some of this. I think Bob Dole, our own former senator of Kansas, dispelled when he was willing to share the whole concept in public, which is, brave for many reasons.
I do want to ask that. Men can't get breast cancer?
They
false.
can.
So it's a false myth.
False. So men can get breast cancer. It's 1%. Now, there are certain risk factors that can make it higher, but the general going number is 1%. So do we teach men to do breast exams? No, we don't. But should we occasionally, during a physical exam, of course, examine them and do just like we do for women and see if they feel a bump in their breast or up in the axilla, as we call it. So it's not zero.
Not zero. Got to keep checking. Okay, Dr. Nagy, I'm going to ask this one of you, vasectomies. You do a lot of them, and we have video of you doing one here at the health system. But I want to talk, there was some research out of the country about a new gel called, is it Risa?
Risa.
It's a shot injection into the scrotum. It damages the tails of the sperm cell, preventing them from fertilizing the egg. Is that going to would something like that ever take the place of a good old-fashioned vasectomy?
Well, I think the main thing is what's its intent. And all of these plugs that are being created are designed or being designed to be potentially reversible, reversible, like a faucet turned on and off. It's a lot trickier than it sounds. You have to still approach it just like that picture of me doing a vasectomy. Sometimes they're now using ultrasound to isolate the vas, the sperm duct. And there's a very small hole that you have to be able to put a needle into through the skin with local. And there used to be a cement, this one from India, which was a cement, which is designed then to need to be dissolved to unplug it without damaging the lining, without causing partial blockage or scar tissue, right? And the one that you're talking about is a new study that's being done, and there's a clinical trial going to be done in Australia soon, if it's not started already, which is supposed to do exactly that. It'll be a gel that is supposed to mainly block the sperm or decrease its function and not decrease the fluid, which is somewhat minimal anyway from that tube.
So if successful, it will allow you to reverse it.
Yeah, and that's still a theory, because
Right.
that's the intent. And so until these studies mature and prove that they can be reversed, if there was a choice of a vasectomy versus the plug for permanent status, then it's still a vasectomy.
Right.
Right? Because at the end of the day, yes, the technique sounds horrible. I mean, it's morbid in the sense of people don't want it down there, of course. But nor is the injection with the little plug. It's still a procedure.
Still a procedure. All right. Let's take a quick break from this, give you a break. Let's turn over to Dr. Dana Hawkinson. He's got our COVID numbers.
Yeah.
Good morning. How are you?
Oh, we're good.
Good to see you.
Yeah, it was a nice weekend out.
It was.
So hopefully everybody got outside and was able to be healthy. You know, we know the Plaza Art Fair was going on. It was a real nice weekend. Here at the health system, still have over 30 patients in the hospital. We have 34 active infections, with 3 in the ICU, 2 on the ventilator, 22 in that recovery period as well. Overall, though, it is good that right now cases in the United States and hospitalizations continue to overall decrease.
All right, I do want to get to a couple of headlines with you this morning. The first signs of new COVID-19 wave appear to be on their way outside of the country. When we see them on the other side of the globe, what does that mean for us here? Is there anything that we should be concerned about as far as another surge in our country?
Yeah, and as I just stated, we know that the reported cases in the United States continue to go down. We know that the United States does tend to trail behind other parts of the world, specifically Europe, by a few weeks. We know that even parts of the United States tend to follow other parts of the United States by a couple weeks. So overall, yes, it is concerned. While activity continues to be low in those countries, they are seeing a little bit of a rise, and a lot of that is attributed to more of those colder temperatures in those regions, such as the UK and Europe, where people are tending to be inside more. But again, I think this just lends more weight to the fact of the importance of being up to date with your vaccination.
All right, a report from the University of Minnesota finds that some kids and teens have long-term lung damage after COVID-19. How severe are we talking? Is anything parents need to be aware of?
Yeah, I mean, so there was a broad spectrum of these changes that they found. I believe they looked at like 54 pediatric patients. And it should be noted that all of these, but one of the patients, except one of those patients, was unvaccinated. So it is vitally important to continue to endorse vaccination for help in reducing these things, these complications. They did see changes on chest-lung CTs. They also noted that the patients did have problems with like shortness of breath and issues like that, and even lung function when you test their lung function. So I think the important thing here is to remember that everybody can be affected if you're infected. Even those pediatric patients who we know, as far as severe disease and mortality, has been much better or reduced risk compared to adults. But the fact here is that 53 out of these 54 children were unvaccinated. So I think we continue to endorse vaccination to help reduce your risk of any of these complications.
All right, Doc Hawk, who are these people who are not getting COVID? They've been called the super dodger.
Yeah.
Why are they not getting affected? Do they have some super immunity? Who are these people?
It's really hard to understand.
You're one of those people.
Well, I've been in some, I've been to concerts and have been to dinner with friends. So far, I don't know that I've had it, but again, I've been vaccinated. Is there a chance I was asymptomatic? That is certainly a chance, but we know that people who are fully up to date will still can get infected. Again, the vaccination is more like a seatbelt. It doesn't really protect you from getting into a car wreck, but what it does is help reduce that severity. Now, we do know early on after vaccination, probably 3 to 6 weeks, you do have that added benefit of reduced chance of infection, but that was occurring more in the pre-Omicron stage. But we know you still have that benefit now, and I think that benefit will continue to exist. Although it is minimal, it should last after that booster, but it's really unclear exactly why. I think it does break down to luck. We do hear other stories. I know One podcaster in particular, Andy Slavitt, was talking about how he felt he was one of those super Dodgers. So he was out, out to dinner with friends and ended up getting it. So I think it's just more a matter of luck than anything.
All right, Doc Hawk, thanks so much. Let's check and see if we have any reporter questions on the line today. Okay, we are good to get to our community. I want to ask you about, well, Sarah, I'm going to just jump in. Sarah asks, is it true that men only use 10% of their brains? What?
Who are you asking?
I'm asking.
Two guys. Fatal mistake.
It is
we
a fatal
use
mistake.
5,000% of our brain.
No, and no. Okay, so 10%, is that?
I have no idea.
Does this explain a lot?
I guess I don't use much of my brain if I don't have an idea. But
well, I
don't.
guess, but you're one of the smartest guys I
don't know. I don't know the answer to that.
You don't know the answer.
I don't.
That's your answer. You're sticking to it?
Only 1%.
I think we just figured out the answer.
And only 1% of our heart. So.
Only 1% of your heart, 10% of your brain.
The other 90% of your brain is in your testicles, so I don't know.
All right, Sarah, hopefully that answered your question perfectly. Okay, I want to ask you about man buns. Are people still wearing those, first of all? Is that...
Ask Jake.
I just cut mine.
You had one.
I had one.
You are one of the. You're one of them. Okay, fantastic. So, did it affect your hair? Some people are saying that it might lead to hair loss or wearing hats and things like that. Did you find that? You look like you got a good head of hair right there.
There was some data on something called traction alopecia that I think made the news in several regions, which is just when there's a lot of tension on your hair, leading to the hair being ripped out. But after having a man bun, it's pretty obvious when you have a lot of tension because it doesn't feel so good. So yeah, I think if you feel like someone's constantly pulling at your hair, it's possible you may lose those follicles. But having male pattern baldness or just frank baldness from it is very unlikely.
Why'd you cut it?
Significant other's opinion.
Okay.
I used to have a man bun.
You did not.
I did. No, I didn't.
This is what happens.
This is what happens when you have a man bun too long.
It's way too tight.
It's very tight. Okay, Sarah, on a serious note, Emma wants to know, and I think this is so interesting because through COVID we talk so much about mental health and we talk about all the rest of the body being taken care of, but let's talk about the mind. For men and women, but let's talk men. What are you guys seeing as far as that? Do those conversations come up in your practice as far as just making sure that men are well mentally? Dr. Fantas.
Yeah, so I actually screen all of my patients for depression and current emotional status just because it interferes with so many of the things that I do. I mean, again, I hate to bring it back to erections and to testosterone, but truthfully, people that come in with all these non-specific symptoms, they're not sleeping well, they don't feel well, they're having problems with their relationship, with their erections, and when you get right down to the root of it, a lot of it has to do with their current mood, and some things are, adjustment disorder to the current situation with COVID, some are due to issues at home and otherwise. So I think again, if there is a pitch here to come see your physician about any of these issues, you may be sent somewhere else, but it's really important to kind of take care of men's health in a holistic fashion. So
Are they opening up? Are they opening up more?
Yeah, so again, I have a screener that I send out, and usually people are more willing to talk about it once they've been desensitized. They're like, you know what, I have been down the last several days this week. I'm not finding things that really make me happy anymore, and they absolutely do.
Now, one of the things, though, I think that's very important. I don't know if you saw that over the weekend, the CDC came out with this issue of screening for anxiety and depression from, I think, into their early teens. And 26 or something like that % of men had, or adults, had defined anxiety and depression. Right? Well, I think it's higher in women. But I always like to say this when I come to this show, is we have, been so overwhelmed by social media, email, instant access. We don't let that brain rest for multiple reasons. We're always exposed to negativity, anxiety, sadness. I mean, if the world isn't a bad place, then how do you, and we see so much in the news that it's hard to see goodness. And or whenever you can shut your phone off, we use it as our alarm, we use it as our form of, music. That's great, but we keep it by our bedside and we never let our brain rest. So sleep, I think, is a huge issue where we don't let our bodies rest and our minds.
All right, I want to ask you a question. Somebody asking if cell phones, Jupiter is asking any correlation between cell phone in the front pocket and sperm health.
Do you want to answer this? I don't actually know, but go ahead. Do you know?
No, I know they've done studies with this and with laptops, and with the exception of having excess heat that we already talked about, realistically, I've seen no data that shows any changes in sperm count.
And there is data from a while ago, Ashok Agarwal, Cleveland Clinic, and a few others, who did question that exact question about laptops and cell phones. Again, a myth buster is right now the answer is based on limited data. No, it's not an effect. If you think about that all of the radio frequency waves we're exposed to, or at work, or in the military, that could be, a concern. But is it? We don't know. We don't know. I mean, we're in a new world of Wi-Fi, and I think it's going to take a bigger population study to kind of investigate that.
Just want to revisit something we talked about at the top of the show from one of our viewers. Yan Liang wants to know about wearing tight pants again. And what is this word? What is that? Could it lead to
Varicocele.
Varicocele.
So a varicocele, just for everyone's information, is a bunch of veins that are normally there, but they just get larger, like varicose veins. So can tight pants cause that? No. You'd have to really be constrictive at a high level, and varicocele is not something that it doesn't occur from strangulation, if you will. It's different. So no, tight pants do not cause varicoceles. How interesting though is that the correlation of varicoceles, which is like an internal heating blanket, and infertility is real. And I say association because I don't know 100% it's due to heat, but that's a suspected cause. So it's kind of ironic that we do actually see men with varicoceles that affects their sperm count, partly potentially due to heat. And just to put that into perspective, 15% of men in the community may have a varicocele, but 40% of men who come and see us for infertility have a varicocele.
Question, and then I've got a couple for you, Dr. Hawkinson, before we go. Emily wants to know, if you can answer this, my husband has strong genetics for dementia, including high blood pressure despite healthy weight. He began treatment for high blood pressure in his early 20s and is in good stats right now. As he ages, will this decrease his age of onset of dementia symptoms since he began treatment early? Are there other side effects of decades of using high blood pressure medication? Can either of you, I know that's not your lane, but can you have any insight into that?
Yeah.
I can't.
You got it.
Yeah, that's a little bit out of our lane. I mean, I think it does talk about the importance of being on these medications that control things. I mean, there are different types of dementia, and if they had vascular dementia due to somebody having hypertension all the time, then sure. But realistically, I mean, there's too many causes. I think it's a pretty broad question.
Yeah, I think you need to ask a neurologist or a dementia specialist to that one.
But tight pants, that's your specialty.
That's my type. Yeah, well, sorry. Thanks, Mum. Thanks for getting me educated.
So you talk about scrotums and tight pants at 8 in the morning. Okay, I do have a couple of questions for Dr. Hawkinson, if I could get to those really quick. Okay, another one's coming in for you. Okay, question about, okay, we get this a lot, Deanna. We're scheduled to get bivalent shot today. Do you recommend going ahead and getting the flu shot?
Mm-hmm. Yeah, you can absolutely get both of those vaccines at the same time.
Okay, another one we get a lot. What is the best time to get bivalent vaccine after having COVID?
Mm-hmm. Yeah, the CDC recommendation is that, again, never miss an opportunity to vaccinate. Certainly you are able to get the vaccine after you have recovered from that acute phase because, again, they don't want you out in public when you are still infectious. But there is also that consideration to waiting 90 days after that acute infection. That has been pretty much, for the most part, our recommendation is waiting that 8 to 12 weeks after that acute infection, because that acute infection will give you that natural boost, not only to spike, but also other components of the vaccine. So I think that's fully appropriate. And if you had it recently, if you wait that 8 to 12 weeks, that should also allow you to get that vaccine around the holidays, especially Thanksgiving or Christmas or New Year's, and then you'll be maximally protected during that time as well.
And check out the bit.ly link on the screen, bit.ly/fall vaccines for more information about that. Last one for you is from Janet. There was an article stating there are 3 new variants, with one being resistant to the vaccine and decreasing the effectiveness of Evusheld. What does Doc Hawk think? So what do you think?
Yeah, I haven't seen those specifically. We know that we were always concerned about the decreasing efficacy of Evusheld. And remember, Evusheld is that prophylactic or that pre-exposure antibody cocktail. It is 2 different monoclonal antibodies that are given to people who can't get the vaccine or who probably won't have a good response to the vaccine, likely because of immunosuppression or some comorbid condition like that. We know that there was always that concern, and I think there is a couple variants that certainly could be found to be more resistant, or the Evusheld is not effective. But right now, currently what we have with the Omicron subvariants, it is still working. But I would expect a variant to come down the pike that is not. As far as resistance to the vaccine, I'm not exactly clear what that means. I mean, the best data that we have is certainly you can have that antibody escape. However, the best thing that we do have is our T cells, and what it looks like is the areas on the spike that our T cells react to are conserved, meaning they change very infrequently or not very much at all, and we still get an immune boost and have protection from hospitalization and severe disease from those T cells. Even that original vaccine shows that to be true. So right now it looks like the vaccines continue to be effective, even if there is some escape of the antibodies that are elicited by our vaccines. We still have that immune response from our T cells. So, but I'll certainly look into further exactly what that question means about resistance to the vaccine.
Doc Hawk, thanks so much.
Yeah.
Let's get to our final thoughts. Guys, great conversation. I know we always have a good time when you're on. But before you go, we want to make sure our men are well taken care of and are seeking the help they need, getting the screenings. Dr. Fantas, just your final thoughts, anything that you really want men to head out into the week thinking about?
Yeah, if something sounds too good to be true, it probably is. So obviously corroborate any kind of evidence for any kind of, traction alopecia or any kind of nutraceutical that's going to completely cure all of your problems, especially in the sexual realm. I would consult with your physician first.
Thank you so much. All right, you've said it all today. Anything else you need to say before we go?
No, just imagine me being the person before Men's Health and Jake being the person after Men's Health. And it's hard to believe Jake's actually 60 years old.
He looks amazing.
So don't you see what the difference is when you actually do the right thing? And all I have to say is take care of yourself, guys, because basically, the problem is we don't. And if you want to live a long life, to be healthy and obviously have a good quality of life, then we all have to chip in. So take care of yourself.
Gentlemen, thank you so much. Have a great week. Dr. Hawkinson, final thoughts from you today.
I just want to thank our guests. I think Dr. Nangia pointed out some good things. It's always coming back to infections. So certainly we know that in semen, you can still have detection of virus for quite some time. We know, and really the best evidence supports the fact that the Ebola outbreak in Guinea in 2021 was likely caused by a survivor of that Guinea outbreak in 2014 to 2016. Possibly, likely because there was some protected continued virus in semen. So it was probably started from that is the best evidence that we have. And we know also monkeypox DNA can be detected in semen as well. So we're trying to understand all about that. So I think his points about infections in semen and sites in the body where we can still have immune privileged areas is very spot on. And also going to our headlines, talking about the children and their detection of lung changes even after mild illness certainly continues to be important, and we know that vaccines can help reduce that risk of those things happening not only to children but of you as well. So we need to continue to endorse and promote vaccination. Please get up to date with your COVID-19 vaccination, especially as we are expecting further surge or increase in cases as we move into these colder months.
All right, Dr. Hawkinson, all our guests today, thank you so much. Helping accelerate clinical research in the Kansas City area. The University of Kansas Medical Center has received a $27 million grant for the National Institutes of Health. It will fund Frontiers Clinical and Transitional Science Institute at the University of Kansas. According to a news release, Frontiers accelerates research by connecting scientists to resources, facilitating collaboration among researchers, communities, and institutions, and they offer training. U.S. men are in poorer health and dying faster than other men around the world. A report by the Commonwealth Fund found about 30% of American men have multiple chronic conditions compared to other countries like France and Norway that had about 17%. Researchers also found more American men die before the age of 75, a higher rate than the other 10 countries in this report. They say a lack of universal health care, a lack of trust in the healthcare system, added to poor diets, alcohol, and smoking are mainly to blame. Well, thank you so much for being with us today. Don't forget, you can catch our updates anytime by logging onto Facebook, YouTube, and Twitter. Go out and make it a fantastic week, a great start to this Monday, and we'll see you back here tomorrow at 8 a.m. Coming up tomorrow on the Morning Medical Update. This picture is a heartbreaking reminder of the impact of COVID-19. Antonio Gutierrez battled COVID more than 80 days in the hospital. I'm Jessica Lovell. His story is a stark reminder that COVID is still with us. We'll meet the family behind these very telling photos Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.